Our work takes place on the unceded, ancestral, traditional, and shared territories of Coast Salish peoples. We recognize the importance of advancing truth and reconciliation to affect systems change that lead to equity and inclusion, and that I am personally joining you from the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations, colonially known as Vancouver. Um, I would then like to share that I am joined here by my esteemed colleagues. We have Manveer Aujla from Surrey Local Immigration Partnership, Elizabeth Mayorga from the Tri-Cities Local Immigration Partnership, and Tabata da Costa from the Tri-Cities Local Immigration Partnership as well. Just a little bit of an overview on today's workshop. It is interactive, so although we are presenting some really unique things about each of these different projects, we are expecting to do a small group discussion, so be prepared to participate and to join in these discussions, because I think there's a lot that we could learn from one another as well. And so there will be 4 presentations on different projects, and then we'll do the small group discussions and a report back. Many of you may already be familiar with local immigration partnerships, but just in case you're not, local immigration partnerships are strategic planning tables that engage a wide variety of stakeholders. And our role is really to work with all of these different stakeholders, different partners in communities across Canada to strengthen welcoming communities for newcomers. And so with that, I'm going to pass the microphone on to Manveer.
Thank you so much, Elizabeth, and thank you to everyone for joining our session today virtually. I want to start off by talking about, our theme around advancing systems change through community-led collaboration, and speak to some community-led engagements that we've done with the Surrey Local Immigration Partnership. Abigail, advance the slide. So just a quick run through of the agenda of the presentation. Just gonna brief and intro yourself to the Surrey LIP, speak about our engaged community strategic priority, dive into the case examples that we have for the community-led engagements that we did in partnership with the province of BC, and then again speak about Surrey LIP's role in fostering these relationships and making sure that the community is engaged and that this engagement has utility moving forward, and what other LIPs and other service provider organizations can do to make sure that their clientele gets more involved. I also wanted to make a land acknowledgement for where I live, work, and play, and then the work of the Surrey LIP takes place. So on the ancestral, traditional, and unceded territories of the Semiahmoo, Coquitlam, Kwantlen, Qayqayt, and Musqueam and Tsawwassen First Nations. We want to recognize that the knowledge and traditions of these communities are significant in providing context to the work that we do. And the Surrey Local Immigration Partnership recognizes the importance that reconciliation has in building truly inclusive and strong communities. So as Abigail had mentioned, the Surrey LIP, of course, many of you are going to be familiar with local immigration partnerships. The Surrey Local Immigration Partnership operates very similar to the LIPs that you may interact with through your work. But, as British Columbia is one of British Columbia's fastest growing cities, we feel like the Surrey LIP is uniquely positioned, and we want to make sure that our work is focusing on ensuring that the unique needs and contributions of immigrant communities are recognized. We want to make sure that the Surrey LIP is focused on facilitating integration processes and fostering that collaboration between the city's service providers, and then also being able to create a platform for dialogue and collaboration between those groups, between government, community organizations, and other interested parties to move forward and enable policy and initiatives. So again, very similar to the work that you may be familiar with the LIPs that you may interact with in your locales. Next slide, Abigail. So through the LIP, we've been able to go through a community planning process. We actually just released our community plan for the next 5 years. And through engagement with our council and through our clientele, we came up with a strategic priority. We had 5 strategic priorities, and one of those strategic priorities was engage community. So, with more than 45% of Surrey's population being made up of newcomers, um, engagement with the entire community within Surrey is complex, but we feel it is very important. So the overarching goal of this engaged community strategic priority is to be able to cultivate a sense of belonging and empowerment amongst newcomers, and ensuring that they have the opportunity to actively participate in all facets of civic life. So with that, we came up with an overall goal, kind of our vision for what we're hoping to accomplish with this strategic priority, which is for Surrey to have a welcoming, inclusive city that supports newcomers, to make community connections and actively participate in all that Surrey has to offer. And with this, we want to make sure that we are increasing awareness of specific needs of newcomers, to inform adjustments to programming. And we also want to make sure that we're collaborating to ensure that there is that increased involvement of newcomers in community and civic planning processes. So this could look like, being part of committees, boards, advisories, again, taking part in some of those public engagements, and again, looking at how the LIP can be that facilitator for that. Next slide. So considerations for these community-led engagements, we wanted to make sure that we were asking the right questions. So when we are engaging with newcomers, what is the topic of engagement? What questions are we trying to ask? Why do we need to engage? What does the public want to address, and what would newcomers want to address with this topic? What is on or off the table in terms of the questions that are being asked? We also want to consider what are the risks of engaging and what are the risks of not engaging with particular communities? What voices would not be heard, and how would that impact the overall projects here? We also want to see that, what is the reach of the engagement? How will we follow through as well? So how far and wide should the reach of the engagement be? What are the budget and the timeline that the parties might be working with respect to engagement? And I think what's super important, how will we report back to the communities that we are engaging with? And how can we make sure that the public's input was used in actual decision making? So, you see within there the levels of engagement that some of you might be familiar with through the IAP2 framework, in terms of, are we informing these communities? Are we consulting with these communities? Are we involving them? Are we collaborating with them? Or are we empowering them? And I think that's definitely really important to consider when you're conducting your own engagement, or you partnering with another party to conduct engagement as well too. So you see a key quote that I pulled out from there: the key to building an ongoing cultural participation with a diverse citizenry is to consider each interaction as an opportunity to build relationships and partnerships toward shared goals. So we wanted to, again, what does it take to make collaborative public engagement, especially when you're collaborating with newcomers as well too? So we have these 5 conditions in terms of working towards shared goals. So making sure that we are working in partnership with communities. There should be a clear commitment to be building the capacity of these affected communities and incorporate their contributions into decisions. We want to make sure we're including participants. So legitimate engagement depends on input beyond the usual suspects. When it comes to a lot of civic engagements, there are the same voices that are constantly being heard. So how do we make sure that there is legitimate engagement beyond this? So that requires a conceited effort to seek out those missing voices. We want to make sure that we're creating conditions. So we want to make sure we're giving appropriate information and structure to these communities. That way they're able to engage appropriately and with the appropriate amount of information. We want to increase in understanding. So again, some of the most powerful forms of public engagement, use professionally facilitated small group discussions, and having those diverse ranges of engagement can embrace a multitude of learning and communication styles. So someone might not be able to complete an online survey, but they might attend an open house where they're able to have that one-to-one conversation. So making sure that there are a multitude of ways of being able to be engaged. And then that what we talked about, that commitment to transparency. So again, one of the largest barriers that we see in public participation is that the belief that citizens feel like their input actually is not going to have any impact on decisions. So there needs to be from the get-go a commitment to responding to participants' recommendations, and for an opportunity for those participants to evaluate those responses, again, to make sure that their input actually had a change in terms of decisions that were made. So I just wanted to speak about two public engagements that the Surrey Local Immigration Partnership had recently had conducted in partnership with the province of BC. These were public engagements that were happening across the entire province, and the goal of the province was to work with community organizations who are rooted in work with communities to facilitate and lead these engagements, and be able to report that information back to provide insight on how they were going to move forward with these two specific projects. So the first project was the anti-racism legislation. Here was a project that the government was asking for input from racialized communities as well as racialized people from faith-based groups and other communities to ensure the upcoming anti-racism legislation would actually have a meaningful difference in these people's lives. So the idea behind the community-led engagement sessions was that they would be culturally appropriate, safe, and responsive to the needs of each community. 68 organizations across BC received more than $300,000 in funding to engage their respective community members. Grants were of up to $5,000 were shared, and this helped those community organizations cover costs such as honoraria for participants, facility rentals, and any maybe engagement supplies that we needed. The grant recipient organizations also all received anti-racism awareness and education, resilience training, and for those who have experienced racism and social services, as well as a way to promote diversity through arts and culture. So the province was providing these training sessions for those community groups who might not have the capacity. They might be using volunteers to run these sessions. That way they were able to effectively facilitate it. Yes, it wasn't professionally facilitated, but it allowed the community groups to have those tools. And they also provided templates in terms of having standardized questions to be asking the groups, as well as reporting templates for you to be able to capture that information and be able to provide it back to the province as well. The second example was the Canadians of South Asian Heritage Museum. This was, again, a similar community-led engagement project. 44 organizations here had a target of reaching up to 9,000 participants within those community-led sessions. And again, it was an opportunity for those sessions to be hosted in localized languages and environments and formats that best suited the interests and needs of those particular populations and the community groups and the clients that they were serving as well. So just in the next slides, we have some photos of the sessions here that we hosted. So on the left, you see the Canadian South Asian Museum Heritage that we hosted in July, as well as one of the sessions that we ran for the anti-racism legislation. And I think the next slide, we just have some more photos as well too. Here we try to cater very much, again, to the newcomer population, and we had some specific sessions. We had sessions with newcomer youth, we had sessions with newcomer seniors, as well as newcomer women as well too, to make sure that we were able to capture all those populations. So in terms of Surrey LIP's role, and what service provider organizations can do. We want to make sure that we're able to raise awareness. So inform community members about municipal or provincial plans and engagements that are occurring, and how those communities will be affected by those plans and how they can participate in those plans. Explore ideas and information, understand the community's perspectives, values, and identities, and again, relay it back in terms of how this can be used in the input of those municipal or provincial plans. Contribute to decision making. So gather feedback and suggestions to improve those existing policies and plans. Seek out these opportunities and find a way. It might not be these community-led engagements, but it might be reaching out to the municipality saying, hey, how can we have a dedicated focus group for newcomers that is going to feed into the engagement? So create avenues or look for avenues that you can be able to garner this feedback and be able to share it back to those partners. Transforming conflicts. So establish or improve relationships between participants, stakeholders, or between the city, province, and the community. A lot of time there is that hesitation for especially newcomer populations to interact with the municipality, with the province, and they haven't built that relationship as well too. It's an opportunity for LIPs and other SPOs to be able to build those bridges so those relationships can start to take place, and mobilizing action. So mobilizing community action to help implement solutions. When that information is shared, how are we sharing those what we heard reports back to the community to say, hey, this is what the engagement had said. Does this truly reflect what the community is wanting for it? Is there an opportunity for a second round of engagement? And when they do come out with those finalized plans, how are you holding those parties responsible to make sure that whatever the communities had said is actually being followed through with and is actually being, put into those final plans that are endorsed by council or passed through legislation. So just a quick example of some of the engagements that we've led. Again, we have our contact information there if you're ever interested in reaching out and learning more. And I'm going to pass it back to Abigail for the next presentation.
Great. Thanks so much, Manveer. That was fantastic to hear about some of those examples. Really inspiring. I'm going to pass it on now to Tabitha Da Costa, who will speak about the Diverse Leaders Project.
Hi, everyone. Thank you, Abigail, and thank you, Manveer. It was really interesting presentation, especially like how you're touching on reporting back after conducting engagement. That's something that sometimes we forget, and then people never really understand how their inputs are being used. So if we're talking about engaging community, engaging partners, this is a very important aspect. Well, hi, everyone. My name is Tabitha Da Costa. I'm the manager of the Tri-Cities Local Immigration Partnership. And before I start, I'd like to acknowledge that the work of TCLIP takes place on the unceded traditional territory of the Coquitlam First Nation, which lies within the shared territories of Tsleil-Waututh, Katzie, Musqueam, Kikhat, Squamish, and Stolo nations. If you don't know where the Tri-Cities is, if you're outside of Greater Vancouver area, we're about like a 1 hour drive away from Vancouver, downtown Vancouver, and the municipalities we work with are Coquitlam, Port Coquitlam, and Port Moody, and 2 villages, Belcara and Anamaro. So that's what the Tri-Cities consists of. Today I'm here to talk a little bit about our Diverse Leaders Project, where we engaged equity-deserving individuals that were leadership candidates and also employers. After me, Elizabeth Mayorga, my colleague, will be talking a little bit more about employers, and I'll focus a little bit more in the leadership candidate side. But I do want, before we jump into the successes, challenges, and lessons, share a little bit of what this project is. So let me put just a timer here so I don't talk at you for like more than I should. So the Diverse Leaders Project really was built with 2 pillars. One, to support equity-deserving individuals to achieve their leadership goals. And that for us meant either engaging civically or engaging professionally. And in both ways, for us, being leadership never meant being a CEO of anything or necessarily being in the board of directors. It really meant for us whatever these equity deserving folks understood as leadership for them. And that can be leadership in our communities. You don't need a position, you don't need a specific role, but we really wanted to approach this with a strengths-based approach, understanding that the folks who were leadership candidates, they already had a lot of what it took to be leadership. They just needed support to overcome the systemic barriers that they faced. And on the other side of this equation are the employers. That's more specific, of course, for the ones that are interested in leadership in their careers. But our approach to the employers was slightly different. It was more around bringing education and information sharing to those employers so they could become more inclusive employers and facilitate the onboarding, the retention, and the growth of these leadership candidates within their organizations. One of the things that was, yes, thanks. One of the things that was very important for us was that we provided tailored supports for both employers and leadership candidates. This is, so because we are a local immigration partnership, our projects, even though we're engaging with employers, we're engaging with equity deserving communities, it's really a pilot project to generate best practices to support the settlement sector and support community partners. So we really wanted to target, okay, this is a iterative process that we're going to generate tailored supports, and we're going through all this process to center the voices of those we aim to support. Therefore, if we are listening to what people are telling us that what they need, if we're implementing, and part of the pilot project and part of like the positive quality of being in a pilot project is that you can succeed, you can fail, and you're going to try again, and you can learn, and then you can generate best practices that can really be utilized for the service providers that are delivering the services to community. We started with enhancing, we started with like a pilot cohort that was composed with our immigrant advisory table. And the idea was to really boost their confidence and look at the strength and what else could we enhance, what kind of skills and what kind of knowledge could we bring to them that were extra, that they really felt that they needed to be able to thrive in their leadership positions. So from this tailored support, I'm going to speak more specifically, but it came out from this first group because we started with a lot of knowledge mobilization and capacity building. We finished it with the feedback being, okay, this is really great, and we learned a lot, but now we needed more specific support. And therefore, that's why I'm going to talk a little bit about the mentorship and coaching programs that we developed. Next slide, please. So, implementing feedback. How did we implement the feedback that we have received from these newcomers? As I mentioned before, initially we started really with like practical skills development sessions. So the trainings, workshops, and then to find ways so they could, as I mentioned before, just develop what they already had. And we have heard from them that what they really needed was besides the knowledge mobilization, but they really needed to have difficult conversations. They need to really have be in spaces where they could interact directly with folks that would support them to achieve their leadership goals. And that was people in HR, people in leadership within organizations, people in leadership within our community, and join these conversations in a two-way street where newcomers were really bringing their knowledge and were bringing their questioning, and we're expecting better answers than you need to fit in this box, and if you go fit in this box, things will work for you. They wanted to challenge, why am I facing all these systemic barriers, and how can I find ways to overcome them? and really listening also from folks in leadership, folks in HR, what they were expecting and what are also the type of education and knowledge that they needed to obtain to bridge the gap between understanding all the wealth of all the richness that newcomers could bring to their organizations. So we did the employment and Insights and Voices of Newcomers Forum. That was a very good opportunity for us to bring conversations around hiring practices. So one of the strategies that we utilized to really bridge this gap was to bring not only people that were hiring to the table, but also bring newcomers with experiences, lived experiences to the table to discuss how these hiring practices impacted them and how everyone could do better. We also had the Growing Together Employment Forum, again, talking a lot about hiring practices and how and this time a little bit more of like how organizations could look at organizational practices and policies to do better and be more inclusive to newcomers. And finally, we had the Cultivating Community. That was on networking event. One of the things that we have heard from newcomers is that the networking was really frightening. And if there is one thing that we know about the newcomer experience is that if you're walking into a country that is a new country, is a new home, you don't know anyone, you probably don't have the networks that matter for you. So walking into the spaces where bringing your own culture and understanding how the power dynamics within the spaces work is very challenging for newcomers. So we really build a space where people are just coming as they are and building relationships before walking into conversations about career or jobs or anything else. Next slide, please. Thank you. So finally, after implementing the feedback from the second phase of the project, we went into the phase, and we are in the phase of deepening the project. The two main aspects of this phase is the collaboration with partners and also developing tools to support service providers and community partners to further the impact of this project. So a lot of the job seekers and leadership candidates who participated in our initiatives really asked for spaces where they could further their networks in deepening the relationships that they were building in those spaces. So we partnered with the city of Coquitlam to implement the Inclusive Mentorship Pilot Program. That was a very interesting approach that brought together the two pillars that I spoke about at the beginning of my presentation. That was really bringing employers and bringing leadership candidates together. One of the most important things for us during this inclusive mentorship was more in the employer side. So it was really use this as an experiential learning opportunity for city staff so they could engage with newcomers and really better understand the skills and the experiences that newcomers bring to our communities to trickle down to their hiring practices. The other initiative, another tool that we have developed was a professional networking tool that was from the learnings from our forum. So we developed two different tools. One is still in the works, but it was really to, so newcomers we could distribute, and we have received like very positive feedback from this. I can post the tool in the chat right after. So service providers could share a tool that was developed from the inputs of newcomers on how they could navigate this networking, this hiring practices, and with really like a very simple and straightforward exercises that are not overwhelming, but it was something that newcomers told us, if I had this 2-3 years ago, that would be really helpful. So we developed a tool for that. And finally, coming soon is going to be our conversations on caring. It's going to be a podcast on inclusive mentorship. One of the things that really came up for us, as I mentioned before, it was the need to not only the networking, but what is the next step for me to strengthen these relationships that I'm building. So we have invited two amazing hosts to work with us in a podcast to really talk about what does inclusive mentorship even means. If I'm a mentee, what should I be expecting? What I should be requesting? If I'm a mentor, how can I better understand other lived experiences that are outside of my own? How I can do better? How I can step back? So this mentorship is not like I am the knowledge holder and then I'm passing on my knowledge to others, but really a two-way street. Whereas me as a mentor, I'm also learning from these newcomers who are bringing such amazing wealth of knowledge and experiences to this country. So that's a little bit of what we did. Next slide, please. If you want to hear more about all these things that we're doing with TESOLIP, follow us on social media. Hopefully soon we'll also have, besides the X and Facebook and Instagram, we'll have a LinkedIn account, and we're going to be sharing all the tools and resources that we have been developing so service providers can share them with their partners and clients. Thank you so much.
Thanks so much for that, Tabitha. That was fantastic, and it's good to hear, you know, the different approaches to engaging around these components. So I'm going to pass it on to Elizabeth, who's going to talk about engaging employers to support inclusive employment and leadership.
Thank you so much, Abigail. Hi, everyone. I'm going to share about our experience at TESOLIP with employer engagement. Next slide, please. And to start, I'm going to give you a little context. In 2023, TESOLIP partnered with WES to activate local employers and facilitate the co-creation of practical and easy-to-implement community-driven solutions that help identify, recruit, hire, and retain local immigrant talent. Next slide, please. Our first step was to invite community partners with business connections to refer employers who might be interested in implementing or updating their hiring and retention practices. However, and here comes the first challenge, our partners expressed hesitation about overloading their networks, knowing the time constraints many businesses face. Instead, these partners stepped forward themselves to join as foundational partners and participated in consultation sessions. These sessions provided insights about the challenges employers face when hiring and retaining immigrant talent. From these sessions, two actionable items or initiatives emerged. The first one, short videos highlighting employer success stories and best practices in hiring and retaining immigrant talent. The second one, the Employer Navigator tool. This includes a website with a service directory to guide businesses in finding, hiring, and retaining immigrant talent, and a concierge. This is a real person that will provide personalized support to employers. There was also another recommendations to train service providers in how to engage with employers. Next slide, please. Some challenges. Implementing these actions presented some barriers. We initially secured commitments from 4 employers to participate in the videos. However, only 2 completed the filming. 1 lacked organizational approval and the other was unavailable. For the Employer Navigator tool testing phase, just 3 employers confirmed participation. While we have some engagement with employers, we are looking to have more. So that's why recently our partnership with this project expanded to include an active role from the Immigrant Employment Council of BC, whose expertise in employer engagement enhances our efforts. This collaboration highlights the importance of tapping into each organization's strengths for maximum impact. Next one. So here are some key findings. Number one, there is a different dynamics. Engaging employers requires a tailored approach. Unlike government or nonprofit partners, employers prioritize solutions that directly address their business needs. They value understanding, industry relevance, and practical support. Challenges. Employers face competing priorities, making it challenging to engage in social initiatives. Additionally, as we know, anti-immigration sentiments and reduced focus on EDI programs have created further obstacles. Employer perspectives. Employers often view initiatives like this as extra work when their primary focus is on running their own businesses. And strategic partnerships. Effective collaboration requires clear role division. In the case of the employer navigation tool, TCLIP's strength lies in building the service directory through existing partnerships, while ICBC excels at employer engagement. This complementary approach ensures we play to our strengths and maximum our impact. And the last one, please. In conclusion, engaging employers in the settlement sector comes with some challenges, but we can overcome these barriers by focusing on their needs and building strong partnerships. By creating tailored solutions, intentional collaborations, and a commitment to delivering value to employers, we aim to drive systemic change. And that's it from me. Thank you so much. And I will pass it back to you, Abigail.
Thanks so much, Elizabeth, for that. And I think it'll be my turn to speak very shortly. Just give me one moment, folks, while I see if I can pin my camera instead of my phone. So I'm joining from two different areas. Sorry. Okay. Now off we go. And we will be taking some questions after the last presentation. So just to give you a heads up that you are able to ask any questions, feel free to put it on the chat if you wish, or you can always unmute. But I'm going to be presenting to you around engaging service providers in mental health literacy and promotion. I would like to share about a project called the Tri-Cities Wraparound Model for Mental Health in Immigrant Families. The aim or the objective of the project is to improve immigrant families' access to culturally appropriate mental health supports and service. This is a project that was funded by the Public Health Agency of Canada, and it fell under the envelope of the most impacted populations from COVID-19. And what we identified as a community through different consultations with our partners was around the need to support the immigrant families who gave birth during COVID or shortly after COVID-19 with all the different social protocols and whatnot, because we did identify in the UBC EDI survey. So the EDI is the Early Development Index survey that UBC hosts. There were some challenging results that particularly immigrant families faced around emotional health and also like the social connections component. So that impacted their health outcomes. So we had 4 objectives for this project. One is to enhance the service provider capacity to promote mental health and service delivery. We knew that there are still stigma around mental health supports and services, and that for service providers in our community, in the community of the Tri-Cities, there is a need to better raise the capacities of the skills, the knowledge, and the confidence of service providers around promoting mental health. The second objective is around raising awareness of the importance of mental health in culturally appropriate ways. a lot of the tools and perhaps the resources that are developed have primarily been with a lens, like a Western lens. And so how does that fit around, the culturally appropriate, responsive ways that that folks can really deliver mental health literacy? And then the third objective is around increasing accessibility of mental health supports and services for immigrant families. So in this project, we tested an intervention, which is the wraparound model, where immigrant families are able to receive case management support. So they were able to participate in one-to-one sessions with a caseworker, as well as small group sessions as well. And that allowed them to really explore, some of the complexity of needs that some families had. And then the fourth objective was around mobilizing knowledge through the Knowledge Hub and community of practice. So how do we share this information in the community? As you can see, these objectives are color-coded because they kind of fit under a collaboration model where, as the local immigration partnership, we're not a service provider for direct services, right? And so we really wanted to provide like a clear roles and responsibilities on who's going to be responsible for each of these objectives. So I already mentioned the project overview, that it was funded by the Public Health Agency of Canada, and it was a nearly 2-year project from August 2022 to March 31st. And it is a collaboration between the Tri-Cities Local Immigration Partnership, or TCLIP, Success as the service provider that provided that wraparound model of support, and SRDC, the Social Research and Demonstration Corporation, who is our evaluation and research partner. So there's some things that are collaborating at work. I kind of alluded to some of the different roles. The role of the LIP for this project was around enhancing the service provider capacity. So identifying trainings and learning opportunities to really support the early year service providers to be able to deliver mental health literacy in culturally appropriate ways. I mentioned that Success was responsible for the implementation of the wraparound model. TCLIP was also responsible for mobilizing knowledge through sharing, best practices, promising practices, and the learnings. But there is also an objective around raising the awareness of importance of mental health in culturally appropriate ways, where it was definitely a collaboration. So for this objective, we developed resources and tools that service providers, so TCLIP developed in collaboration with Success around what these tools look like. How do we ensure that it's culturally appropriate for the immigrant families that we're serving, but also keeping it within the scope of how can other community service providers use these tools to destigmatize mental health a little bit more. So some engagement strategies. One of the key things about this project that's quite unique is that we really wanted it to be immigrant-led. Because it's funded by the Public Health Agency of Canada, there was no eligibility criteria. So anybody who identified as an immigrant was able to participate. We didn't want to call a focus group because we really wanted the immigrants to participate throughout the project length. Like, it wasn't just a one-off consultation piece. Like, we wanted them to be empowered to participate throughout the project so that they can also see, the fruits of their efforts, right? The fruits of their labor, and that to see the changes that were possible. So the immigrant panelists that were invited to participate in the advisory part of the project, we took into consideration that it was intergenerational. So we knew that there's, we really put in that intersectionality lens, that GBA plus lens, in identifying panelists. So we had participants from Cantonese, Farsi, Korean, and Mandarin speaking communities. There's diverse lived experiences in birth giving and immigration, age range, living arrangements, socioeconomic situations were really important. At first, we thought, well, we'll just have one project advisory committee and we'll bring in these immigrant panelists along with different early year service providers so that they can participate. Well, we learned before that even all began, we learned very quickly that there were some concerns and challenges with doing that, primarily because mental health is still so stigmatized in many communities. And because if we are engaging what we call stakeholders or community partners who provide services, and there's the fear from immigrants around the consequences, around disclosing, mental health challenges with those service providers. So that was a really important lesson learned. And so we decided, okay, let's make sure that this is an inclusive, safe space, and that safety was really important for us to ensure that we are empowering, the immigrant families in terms of their agency to participate in this project. And so we had we had the Immigrant Panelist Advisory Committee, but we also had a steering committee of service providers. So we had health authorities, other earlier service providers. We had the Division of Family Practice. So for those who are not in BC, the Division of Family Practice, their local family physician agencies, they're not-for-profit agencies that support, family physicians around quality improvement processes. And also a Healthier Communities Partnership, which we have in the Tri-Cities. So that allows us to really engage a wide range of different stakeholders as well. So some of the innovation that took place, I shared about, how there were some different resources that we developed. We developed the Tri-Cities Family Challenge booklet, where this was disseminated across the whole community, so public libraries. Anybody that has a family program received copies of this Family Challenge booklet, and folks were invited to participate in this challenge. Every month they were able to do a challenge that touched on some of the mental health, social connectedness work that was important around mental health promotion. Immigrant families also shared that, there's a wide variety of feelings, and sometimes that emotional literacy piece may not always come so easily for parents, especially when you're overwhelmed, when you're stressed out, when you have 500 things coming at you. And so we developed these emotional magnets so that everyone in the family can actually share how they are feeling. And we did that in different languages as well. And then another tool or resource that we developed based on immigrant families' feedback around when they participate in programs, whether that's, one that a settlement agency is providing, or if it is from say a public library where they have a playtime type of thing. It was really challenging to deepen connections with others. And so, and I think from service providers' feedback, they also said it's challenging to create and establish that trust and connection with families, because it's either you see people often, and so you've already established that connection, so you want to check in, but then the new families might be more challenging to connect with because you're busy connecting with those that you already know. And so we developed these Art Start conversation cards where folks we used different expressive art modalities to talk about different skills. So for example, building social connections, building confidence, and emotional literacy. So those were the 3 skills that we developed, but we used expressive art modalities to foster those dialogues and conversation. So talking about for this example that you're seeing on the right-hand side, you see we talked about food as the modality, right? And talking about, your favorite food or what made you feel comfort, what comforted you when you're not feeling well, as a way to kind of create that intercultural connection, but also supported, those dialogues around like traditions and values and whatnot. And also an important note for this resource is that we collaborated with Indigenous artists to incorporate, conversations around advancing reconciliation. So you'll see a little blurb about the artist and also how food plays a key role in Indigenous culture, but also in the land that we're in. So we really wanted to bring those in to this project. Some of the outcomes that we saw for this project was around improving service provider capacity around mental health literacy. There were tools that supported them. There were stronger referral pathways. So the knowledge mobilization forums really took into consideration how can we support service providers and mental health professionals to strengthen their connections so that there is a better and improved referral pathways. And then we also talked about enhancing community capacity around, so the piece around community capacity and culturally appropriate perinatal education. It was very timely that we had the perinatal educator provider in the Tri-Cities as part of the steering committee. And through that, they recognized from the stories from the immigrant families and the challenges that there is a need for culturally appropriate perinatal education. And so the project was able to review the current curriculum to look at how can we include culturally appropriate information and resources in those education in that curriculum, but also to look at how do we build more perinatal educators who are from different cultures so that they can be facilitating these education courses. So we were able to support that piece for the project. But there's the piece around the capacity building of service providers and how does that advance outcomes for the immigrant families. We heard from the families that there was increased mental health literacy. There's also increased social connections between immigrant families. So it was really interesting to see when they did the journey mapping for the project, that when they first started in the project, so the families who participated in the program, when they first started, their social connections were very limited to their own family and to receiving newsletters, right? To the end of the project where they connected with more families, they understood what resources were available to them. And so that was really important. And we know that that plays a key role in mental health around the social connections. But most importantly, that the immigrant families themselves were empowered to advocate for their needs. And one of the most amazing stories for this project was that the immigrant families actually started a petition by the end of the project to petition for additional funding, for more funding for this project. And so there was, from our agency's perspective, we didn't ask them to do anything. We just said, we're still looking for funding and we continue to look for funding, but that the project's funding was ending on that date, on March 31st. And it was the immigrant families who initiated a petition to continue and to advocate for whether it's funding for this, but definitely to advocate for mental health promotion for the community. And so on that, I'm going to, maybe I'll stop sharing for a minute just to kind of receive some questions from folks. Feel free to enter into the chat any questions that you might have. I see that Tabitha has shared some of the tools that we've developed for this. and also some of the tools that they shared for the different projects. Are there any questions before we move forward? Nope. Okay. Oh, sorry. Thank you so much. Okay, so then we're gonna keep going with the workshop, because now we're gonna move to a more interactive part of this workshop, which is, here we go, a small group discussion. So you are going to go into small groups for a case study discussion. So the first task that you have is to designate one person to report back. And I think we might still have maybe a little less than 20 minutes now to develop a strategy and plan. So just, it'll be a pretty high level strategy and plan at this rate. But in terms of the case study, so the objective is to increase the civic engagement of newcomer communities to ensure that municipal official community plans are reflective of the diverse needs of the community. We all know that civic engagement is an issue, and so the municipality would like to engage newcomers in the consultation process. The municipality wants to hear from a diverse range of residents, including immigrants and refugees who have historically been underrepresented in civic engagement processes. So your task is to identify potential barriers that might prevent newcomers from participating in these engagement processes, and then propose one initiative that could be implemented to facilitate meaningful engagement from newcomers. And then to share a plan on how community organizations and LIPs can serve as a bridge between the municipality and newcomer communities. So consider including strategies, roles and responsibilities from different services and/or the LIP, and any community resources that you can leverage. So on that note, what we're going to do is we're going to go into facilitated small groups.